Hey guys, welcome to my latest video on English vocabulary. And today's video is another topic about medication. So, specialize in the respiratory system. Respiratory system, what is that supposed to mean? Well, you can look at this picture. Here is the respiratory system that you can talk and you can breathe. So let's get started straight away. We will learn some medical terminology, some vocabulary related to the respiratory system, and some body parts. So let's get started straight away. First thing that we'll know is about some body parts and then the verbs that related to the respiratory system. So let's get started. Here is lungs. And under the lungs we have the diaphragm. You can see here is our body. So here in this part it is our lungs, and under the lungs is also here is this part, which is the diaphragm. And in here we have the nose and the nostril. So what is the difference between nose and nostril? So the entire part here is your nose, but the two holes in your nose is called the nostril. So the two different. When I was little, I thought that nose and nostril are the same. You can use either nose or nostril, but they are totally different. Nose is the entire part, and the nostril is in the nose. Next, we also have the nasal cavity. Nasal cavity includes the nose and nostril, and the oral cavity. The oral cavity, which is in this place between the teeth and the nose. We also have the voice box or the windpipe. So you can either call the voice box a larynx or the trachea, the windpipe, trachea. And in this part, it is the left bronchus and the right one, the bronch and the carina of the windpipe. Next, we have the bronchi, and there are some really interesting body parts. And we also have the example sentence as well. So these are the body parts. I think that if you want to learn about medication, then this vocabulary is really useful for you. But if you do not want to learn about them, then the next part will be chest for you. The first part is just about body parts, but the second part is about some verbs, some nouns that related to the respiratory system. So here is breathe, a verb. Take air into the lungs and then expel it, especially as a regular physiological. Here, a regular physiological. This word is quite tricky to pronounce. Physiological process. So this may sound quite difficult to understand, but here, this is breathing, and when you breathe in and you breathe out, and you expel it out. That is breathing. And here is we breathe can either be a noun or a verb. So a verb that you know in the beginning, and here's a noun, which is the air taken into or expelled from the lungs. So you breathe. You are breathing. I am breathing. That's it. We also have the word oxygen. Oxygen, a colorless, odorless gas and the life-supporting component of the air. Without oxygen, we'll never survive. And if this girl don't have oxygen, then I will never be here, and you will never be on this planet too. You'll be on other side, maybe an alien, right? So oxygen is really important, and you should appreciate oxygen more. Do not take that for granted. Here is a kind of disease, asthma. Asthma is a term, and it's a kind of disease that related to the respiratory system. Asthma is a condition in which your airways narrow and swell and may produce extra mucus. And this can make breathing very difficult. Normally you breathe like this. Really easy, right? But when you have asthma, then it would be really not so easy. So it's like this, like that. You have like shortness of breathing. It's very difficult to breathe. So for the treatment of asthma, usually treating the steroid delivered into the lungs by an inhaler. So this is a steroid. So it's actually like a normal machine that helps you breathe more. A normal machine that helps you breathe more. So we have the word inhaler. Here is actually a noun, airways. It is the passage by which air reaches a person's lungs. So here, actually, you can see that they are pointing to this part. So that is the passage by which air reaches a person's lungs, the airways. That is the airways. And the synonyms is the windpipe, or you called by this word. And here is the mucus. Mucus is a normal, slippery, and shrinking fluid substance produced by many lining tissue in the body. So mucus is something that, like the mucus in your nose, you have mucus, right? When you have a cold, you sneeze, you cough. So like these sticky things in your nose is called the mucus. And this word is quite tricky to pronounce. Okay, so don't look at this yet, but if you look at the first one, what do you think of this word? It's how it's pronounced. What do you think? It is pronounced phlegm. The PH is pronounced as an F, and the G is silent. So phlegm, phlegm. When we first saw this word, we will definitely say that phlegm, but that's not the right pronunciation. It is wrong, and the right pronunciation would be phlegm. Phlegm. Remember, PH would turn into F, and the G is completely silent. So we pronounce that phlegm. And another term, shortness of breath. Well, here is the definition, which is, if you're a beginner and you see this, it's quite difficult to understand. Here, shortness of breath is an uncomfortable condition that makes it difficult to fully get air into your lungs. And like a difficult definition, that's a difficult definition for you to understand. But an easy one would be like shortness of breath. You have difficulty in breathing. Normally you breathe normal like I do, I'm breathing when I'm talking. But if you have shortness of breath, then you have shortness of breath and it's very difficult to breathe. You don't get oxygen right into your nose, so it's really difficult to breathe. Here, shortness of breath. This one is shaking, that means it's difficult to breathe. And here is a pulmonologist. Pulmonologist is a physician who specializes in the respiratory system, in this body part, in the respiratory system. Your lungs, your throat, and talking about the type of doctor. If you want to know more about them, then check out my Dr. English Vocabulary in Context. And back to the video, we have cough. Cough can either be a definition. Here is a definition. It is like very, very difficult to understand. But let's read together to practice your reading. A cough is a voluntary or involutionary, like voluntary or involuntary act that clears the throat and breathing passage of foreign particles, microbes and irritants, fluids and mucus. If you learn hard enough, then you can easily understand this. But a cough simply means that the cough simply means that. You don't have to know all the words in here, but for the cough word, simply means that you have a cold and you cough a lot. And remember, when you cough, cover your mouth with your hand. This part, because you rarely use this part, but if you cover your full hand, then you will use your hand in writing, touching things like touching the remote control, so you must use this body part. Cough. And cough, it can be a noun or a verb, like I said before. For a noun sentence example, she has a cough, and for the verb is the patient coughed a lot this morning. So like cough. She has a cough, that's a noun. Cough in this situation is a noun. But in the second example, in this situation, patient coughed a lot, it is a verb. exclusion of air from the lungs through the nose and mouth, usually caused by foreign particles irritating the nasal membrane. So sneeze simply mean like this. Achoo! That's sneezing, because when you feel like you need to sneeze and you have a cold, then you would like want to sneeze right away, straight away. So this is sneeze, and make sure you know all the words in here. And sneeze, like I said before, sneeze can either be a noun or a verb. So for a noun sentence example, a sneeze can help clear your nose, of course. If your nose are really sticky with mucus, then a sneeze can really help you. And for the verb sentence example is this: she sneezed a lot this morning. She is sneezing, she sneezed. That means it's a verb. Her action is sneezing. We have a word, like a term, chest infection, and a chest. Here's the chest, your chest. Chest infection is an infection of the lungs or large airways. Some chest infections are mild and clear up on their own, but others can be severe and life-threatening. So chest infection can really dangerous, seriously, really dangerous. Like if you are a strong person, then you can easily get away with chest infection. But if you have not a very good immune system, then yeah, you have to stay in the hospital and the doctor will treat you. And here is, we have two words, inhale and exhale. Inhale and exhale is opposite from each other. It is opposite. Inhale the verb and exhale the verb too. So if you look at the definition, inhale is to breathe in. Inhale to breathe in. And exhale is to breathe out. Exhale. When you breathe in, you breathe out. So let's try this one more time. Let's do this exercise together while we are learning. So inhale, exhale. Breathe in, breathe out. That's it. Because when you are meditating, you often breathe in, breathe out like that. So inhale and exhale. If you are your English is on the up level, then I think you should use the word inhale or exhale. Do not use the word breathe in or breathe out, because you can use it, but it makes you a beginner. So you must level up your English more. So here, have two examples. We inhale oxygen all the time. Like in this house, oxygen are everywhere, and we should inhale them. We should breathe in the oxygen. And for the exhale, the patient exhale deeply after procedure. Exhale deeply after her procedure. And here is inhalation, a noun, the action of inhaling or breathing in. And also exhalation. Exhalation, the action of exhaling or breathe out. Like I said, this is a noun, and for the verb, it is inhale or exhale. But if we turn these verbs into a noun, it will turn into inhalation or exhalation. And we have two examples. You need to take a few deep inhalation, a few deep one. And the second one, exhalation, is the patient exhalation are very raspy. That means that it's really raspy and it's hard to breathe. So that brings us to the end of today's video. Thanks for watching, and see you in the next video for more video like